Omicron infection numbers continue to climb on the local front, and for more on the domestic situation, I have Dr. Kim Sik-taek at Institute Pasteur Korea live on the line. Dr. Kim, it's good to see you again.
Good afternoon.
I also have Professor Shim In-ha at Sungchul University joining the session virtually as well, of course. Professor Shim, it's a pleasure to see you again.
Thanks for having me.
Dr. Kim, we'll start with you. Let's begin with a few words then on our current COVID-19 situation, Dr. Kim. As we have recorded a total of over 2 million cases on this Monday in a span of 2 years and a month since our first infection.
Well, I think current status is actually especially on the some severe COVID-19 cases. I think the number is actually following the total number of COVID-19 infection, and then this is just quite obvious, just when we actually consider the incubation time period. Incubation time is actually just the time between virus exposure and then the symptom onset. And then this incubation time, it actually just varies depending on the people, and then it can be just 2 days or like 14 days. And even just developing the severe symptoms, it takes time. It's like at least just a week or so. So then we are actually just seeing the some kind of the effect of the some sort of the Lunar New Year's traveling, and then and also potentially some secondary transmission event right now.
Right. And Professor Shim, you've been using mathematical modeling to derive weekly COVID-19 forecasts here in the country. What do your findings, Professor Shim, tell you about the future course of our outbreak here in the country?
Sure. The daily infections have nearly doubled in just a week after surpassing 50,000 for the first time on February 10th. And this shows how fast the Omicron variant is spreading in the country. So we analyzed the data, and it shows that the reproduction number is estimated at 1.3 now, and doubling time is about 6 to 7 days, which is shorter than the 9 days estimate last week. It means that the COVID-19 cases are still on the rise, and we expect that by the end of this month, we project that the daily confirmed COVID cases would reach 175,000 and possibly up to 200,000, depending on human behavior and our adherence to the social distancing measures. And we also found that 51% of current transmission in Korea is contributed by asymptomatic patients, which makes it harder to track down. So these kind of results are not too positive, I'm afraid, but I hope that this mathematical modeling predictions will help us to plan ahead.
Right. Professor Shim, there's been a bit of discrepancy with regard to the daily tally forecast, with some predicting that more than 270,000 daily infections will be seen in the month of March. How do you explain the discrepancy?
Sure. Well, modeling assumptions and modeling techniques will change our output. And I have to caution that there's a large amount of uncertainty about Omicron that could significantly alter our projections. But basically, in our model, we try to incorporate reporting delays of confirmed cases, because there's a time difference between when an infection occurs and when it's reported. And when the COVID-19 cases are on the rise, the actual number of cases is likely to be much higher than the number of confirmed cases. So for a more accurate estimation of a pandemic growth rate, we analyzed an epidemic curve according to the date of symptom onset rather than the date of reporting. And this can improve our results. And of course, those underlying assumptions for mathematical model can affect the predictions and making some differences between modeling outputs as well.
Right, I see. Meanwhile, Dr. Kim, I believe we touched upon this particular issue during our session on Friday, but there are still continuing conflicting views with regard to the government's decision to extend by 1 hour the operation hours of dining and drinking establishments. What are your thoughts on this?
Well, actually, just before deciding the government's decision on this 1 hour extension, well, just before that, I actually expected probably just the government would just maintain the previous weeks, the social distancing, the measures. So there's actually no change for for upcoming a couple of weeks. But then they changed it. I think just 1 hour extension I think this is kind of just some minimum just a change that the government would just take. And then obviously this is kind of a compromise in between just the two different just arguments. One is the from the experts' view is some extreme measure is probably just a social lockdown, but the other on the other hand is the other just no just the current measures. But somehow just the government's just role is just a compromise two different just the views and then just make a decision. But whatever the outcome is, I think my personal thought is that maybe just maintain the previous just week's just decision, and because now just we are in the situation on the some escalating just the numbers are escalating in terms of a total number of COVID-19 cases and also just following the severe COVID-19 cases. But then we will see, I mean, in the near future, what this decision would just how this decision would just affect.
Right. Now, Professor Shim, in an interview with the local media last week, you claimed our current COVID-19 situation is the most precarious. Now, that being the case then, what are your thoughts on the 1 hour extension in business operation hours, that is, for dining and drinking establishments?
Well, it is the first time that the daily cases surpassed 100,000 in the country. And we have to keep in mind that the nation is facing its most critical juncture since the onset of the pandemic. So I am concerned that now might not be the best time to ease social distancing measures. But I agree with other researchers that we should wait until we reach a point where we can say, well, outbreak has peaked and is in decline before we carefully start easing social distancing measures just like other nations.
Right. Dr. Kim, COVID-19 patients in their 40s with underlying health conditions are now eligible for Paxlovid. Do you believe the age limit needs to be further lowered?
Well, it's hard to tell. Actually, just this drug is also just eligible for just the younger people. But then the key point is that whether we have the enough supply for the Paxlovid for all these COVID-19 patients, but the situation is not. So there is some government is try to just set some priority. Well, who will actually get the Paxlovid as a priority group? And then I think there are some certain criteria who will get the Paxlovid, and one of some negative sign is that if there's some underlying just medical condition, if they are just a COVID-19 patient, they cannot take it. So then there's maybe some suggestion, but this has to be actually consulted with the physician. But because the Paxlovid is only taken just 5 days, so that if some drugs are not really essential for certain people, but those people are with some underlying some medical condition or some elderly people, maybe they can just hold just their regular just medication just for a while, and then take the Paxlovid, and then after that resume their original just medication. But that has to be actually consulted with the physician. And then I think the practical way of replacing the Paxlovid is actually using the other just medication. For example, now we have the remdesivir, which can be actually very effectively used for the mild COVID-19 patient, and then the efficacy is quite just comparable to the Paxlovid. And but only just the disadvantage of this remdesivir at this moment is this is injection drug, but those patients actually have to visit the hospital the 3 days. So I think personally, I think this remdesivir may be just appropriate for just people in the some nursing hospitals and then nursing homes, because they are already now just living in the some confined some space, and then they can get some medical attention without just visiting hospitals. And then if the remdesivir is just some enough supply, this could be some alternative just medication in addition to the Paxlovid.
Right. And Dr. Kim, staying with treatment efforts, where does Korea stand in its efforts to develop an oral drug to treat COVID-19?
Well, as far as I know, I haven't heard any just the big just update regarding any oral drug development in Korea. But some globally there is some update just recently. And then, well, when after the Omicron variant just appears now, just many just monoclonal antibody actually that actually did not have any just effect. For example, including the monoclonal antibodies from Regeneron and then Eli Lilly, and then even just a Korean the Celltrion one actually did not show any good just neutralizing activity against the Omicron variant, except only the sotrovimab. This was actually developed by the GSK and the Vir Biotechnology. That was the only that was actually the only just the monoclonal antibody that was actually effective against the Omicron variant. But just recently, the Eli Lilly and the Epsilon actually developed, and then now the new just the monoclonal antibody was actually approved for emergency use by just U.S. FDA. So now we have just additional just a weapon for against the just Omicron variant. So in summary, we summarized the some different different lines of just drugs for against the Omicron right now. Just the first line of the defense is the Paxlovid, as we are all aware. And then, but as we just discussed, the Paxlovid cannot be used for all the COVID-19 patients. If there are some, especially some kidney problems, those people with the kidney problems cannot take the Paxlovid. And then especially in the U.S., so the second line of the therapeutic option is that actually just sotrovimab that I actually just mentioned, and also some new monoclonal antibody developed by the Eli Lilly and the Epsilon. And then third line of just the therapeutic option is, as I told you, just a remdesivir. And then this is the efficacy is quite just remarkable. It's comparable to the Paxlovid. It's 87%, which is actually just preventing just progressing to the severe COVID-19. And then lastly, just molnupiravir. Although the efficacy is just a little bit just disappointing because it's just 30% of just the clinical efficacy preventing the progression to severe disease. But then this drug does not have any just drug-drug interaction or any other just restriction in terms of just the use of this drug.
Right, I see. Meanwhile, back on the Omicron front, Professor Shim, what is your forecast on the timeline and scale of the peak of Omicron here in Korea?
Well, we can examine how the pandemic progressed in other countries previously. And in the US, for example, it took 3 weeks for the Omicron variant to become dominant strain in that country, and another 3 weeks to reach its apex. And similarly, in the UK, it took 3 weeks until the Omicron variant to become the dominant strain, and another 3.5 weeks to reach its apex. Such a similar pattern was repeated in Japan with the 4 weeks interval instead. And we think that if the pattern repeats itself, the Omicron spread is likely to peak in mid-March in Korea because it became dominant strain about a month ago. And it took 7 weeks for the variant to become dominant in this country. So based on this pattern and mathematical modeling, we estimate that a surge of Omicron infections in Korea will likely peak at 270,000 daily infections in mid-March. And also, it's likely that a week later, we will see a peak in hospitalization, and about 2 weeks later, we will see a peak in number of deaths. That's our predictions based on modeling.
Right, so we could perhaps see an improvement in our situation in April then?
Right.
Right. Dr. Kim, COVID-19 patients will be able to cast their ballots for the March 9th presidential election from 6 to 7:30 in the evening after regular voting. What safety measures do you recommend?
Well, I think it's just 1.5 hours, just voting hour is, I think so just enough. I mean, when you actually consider the number of just the COVID-19 patients and out of just the total just South Korean just population. But then the key issue is that it's actually just protecting the uninfected people from this infected COVID-19 just as a patient. And I think just segregating just these infected just people with, from the some potential uninfected people is actually a good way after the 6 o'clock. But then the question is how we can just protect the uninfected people from these the infected people. Mostly just uninfected people in this case indicate the people who actually just supervise the whole just the voting process, and also the some help the cast the ballot in the some local, I mean just community centers. And I think there's going to be some physical just separation out of just this infected person from the uninfected people. This, well, we can actually think about some travel bubble, things like that, but I don't know exactly how the government will just implement this procedure in the due to presidential election day for now, yeah.
Right, but hopefully safety will be the priority on that particular day as well. Professor Shim, you've mentioned that the human factor could be a major variable in the course of our Omicron outbreak. What other variables are they that could potentially affect the path of our pandemic here?
I think there could be two major factors that may affect the spread of virus in near future. Well, first, new semester will begin in March and schools will reopen. And this is going to change completely the contact patterns in the country. And it's likely that we will see some rise in contact rate among children, especially, and students. And on top of it, the vaccine coverage levels among students are pretty low. And it's actually that 12% of those aged 12 to 19 received the booster doses, and only 71% received the second dose. Plus, based on the report last week, the infection rate among teenagers, that was twice higher than that in adults aged 50 plus. So I'm concerned that a school-based cluster of infection might occur once a new semester starts. So that's my concern. And second, we have to think about stealth Omicron, the subvariant BA2, because it's now accounting for more than 20% of new coronavirus infection globally. So those two factors can significantly affect the infection curve of COVID-19 in Korea, I believe.
Right. Professor Shim, personally speaking, given the concerns that you've been raised, do you suppose the academic arena, including universities perhaps, should opt to have online classes then for the spring?
Yes, I think it would be helpful to have online courses. So it's going to help to reduce the first of infection among students, because that can also lead to transmission to family members in the household.
Right. Dr. Kim, Professor Shim mentioned how the vaccination rates among the teenagers is relatively low compared to that of adults. And having said that, what can you tell us about efforts to perhaps come up with a homegrown vaccine here on the local front?
Well, there are several research institutions and then companies actually developing our Korean just homegrown vaccines. I think the SK Bioscience is one of the frontiers to develop the Korean vaccine, and then some other the companies also developing Korean vaccines. And but I think whether I'm not quite sure whether these homegrown vaccines can be actually widely used in the near future, because now we have actually used many vaccines so far. So mostly just mRNA-based vaccines and then adenovirus vector vaccine. And just recently we started another protein subunit-based vaccine from the Novavax. So I think most of the vaccines will be actually conducted with the vaccines that we are actually using right now. But just in terms of preparing for some future the pandemic, especially some coronavirus-related pandemic, developing homegrown vaccines are still very effective. Very a good approach that we actually have to pursue.
Right. Professor Shim, going back to your modeling, mathematical modeling that is, you spoke about how the number of patients in critical conditions will surge a week after Omicron's peak in mid-March here in Korea. How high are those numbers looking to rise?
We don't have a specific numbers at hand. It's too far in advance. So I'd rather stick with the number of potential infections, and based on it, we can see how fast it will, the number of patients in hospitals will rise accordingly.
Right, and the highest number that you expect this daily tally to surge is 270,000 cases per day, right?
Correct.
Does
yes.
it look to surpass that number? Are there any factors that could perhaps push the number higher to perhaps 300,000 cases per day?
Well, there are a lot of potential factors, such as the school reopening, as I mentioned, and also people are tired of social distancing measures at the moment. So that can also affect the potential curve of a pandemic in near future.
Right, as they fail to perhaps abide by prevention efforts. Dr. Kim, you've frequently spoken about the human factor that Professor Shim mentioned and how about it playing a very pivotal part in the course of the pandemic here in the country. Could you tell us a bit more about your thoughts on that and also on perhaps ways to tackle that reality, the human factor?
Well, just regarding just the current Omicron surge, where there are some things that we cannot change anymore, but still just others that we can change. For the things that we cannot change is that the virus is fixed. Now just the major variant is Omicron that we cannot change at the moment. Although there is a little bit of some surge of the Omicron some subvariant, like some stealth just Omicron, things like that. And then there's some things like some human the immune status that we actually acquired, whether it is just vaccination or just natural infection. But the one thing that I can add is that where actually just vaccination for teenagers, and that actually we can actually increase by just some campaign, and then just increasing the vaccination among the teenagers. Since now we have the vaccines from the Novavax, that might just maybe just promising. And in terms of our just the behavior, well, I think we have to actually expect our very responsible behavior. I mean, there's no need that everybody just get infected by the Omicron variant. So they are just very responsible and voluntary. Just the behavior is very important, and also just the booster shot. I mean, although the third booster shot is the third shot is probably just enough for now, and then still there are some people who did not get the booster shot. So. Getting just a booster shot is something that you can actually achieve in the very near future.
Right. Proactive efforts on the vaccination front then. Dr. Kim, as always, thank you very much for your thoughts. Professor Shim, thank you very much for being with us here with your insights.
Thank you.